So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after let's discuss this test step by step. So it's 62-year-old man. His major complaints is headaches, dizziness and itching after bathing. Headaches and dizziness are classic CNS symptoms, but they are non-specific. In contrast to this, itching after bathing is a relatively uncommon symptom, which is usually associated with polycythemia. He also experienced unusual fatigue for the past few months, which is also a common general symptom. Patient has hypertension, and we know that blood pressure is determined by two major values: its cardiac output and systemic vascular resistance. In turn, cardiac output depends on stroke volume and heart rate. So increase in one of these parameters is responsible for increase in blood pressure. Patient also has facial plethora, which is a common sign of high hemoglobin level, where in simple words, blood becomes more intensely red. Also, facial plethora can be a sign of vasodilation. For example, niacin can cause facial flushing. On physical examination, patient has splenomegaly. Splenomegaly is an important symptom, but at the same time, splenomegaly can be caused by a lot of disorders, so it's non-specific symptom. In his blood analysis, we see extremely high hemoglobin level. 215 is a lot. Also, because he has high hemoglobin level, his hematocrit is also extremely high, 63%. In addition to this, he has moderately elevated platelet count and mildly elevated white blood cell count. White blood cell count can be elevated due to the increase in neutrophils or lymphocytes. Based on his hemoglobin level and his hematocrit, we can say that patient has polycythemia. But the question is, it's primary polycythemia or secondary? Usually, we determine this by erythropoietin level. If erythropoietin level is decreased and hemoglobin is high, then it's primary polycythemia. But if hemoglobin level is high and erythropoietin level is elevated, then it's secondary polycythemia. In this case, we do not have erythropoietin level, but his blood analysis tells us that most likely it's primary polycythemia. The reason is moderately elevated platelet count and mildly elevated white blood cell count, which are characteristic for primary polycythemia. Because primary polycythemia is caused by JAK2 mutation, and JAK2 mutation causes stimulation of entire myelogenesis, which means that red blood cells production is hyperstimulated, platelets production is stimulated, and white blood cells production is stimulated. In secondary polycythemia, it's just stimulation of red blood cells production due to the elevated erythropoietin level. So most likely it's primary polycythemia. Also, because we know that it's primary polycythemia, we can suppose that white blood cell count is elevated due to the increase in neutrophils. In addition to neutrophils, polycythemia also causes hyperproliferation of basophils in tissues. We also know them as mast cells. So let's explain how polycythemia caused all his clinical symptoms. The most specific symptom of polycythemia is itching after a hot shower. This symptom develops due to the hyperproliferation of basophils. Polycythemia causes increase in basophil count. Hot water provokes massive degranulation of basophils. They release excessive amount of histamine, which causes itching. His CNS symptoms developed due to the hyperviscosity of blood. His hypertension most likely is caused by increase in red blood cell count, because with increase in red blood cells, total fluid volume increase, and with increase in total fluid volume in the circulation, stroke volume increase, and with increase in stroke volume, cardiac output increase, which results in increase in blood pressure. His facial plethora is definitely due to the high hemoglobin level. In terms of splenomegaly, increase in size of the spleen most likely is caused by increase in total red blood cell count, because the function of the spleen is to remove old red blood cells. With increase in red blood cell count, the workload on spleen increase, which basically causes spleen hypertrophy. Now, to solve this test, we have to know that the first-line treatment of polycythemia is phlebotomy. It's a medieval procedure but highly effective. In terms of other options, we have to know that prednisolone stimulates myelopoiesis, so this drug is contraindicated in any myeloproliferative disorder. It's polycythemia, chronic myeloid leukemia, and essential thrombocythemia. Anticoagulation is just a supportive treatment. It won't decrease red blood cell count.